Hi, hello, good afternoon, everyone. My name is Yanowit Deshpanyawat, and I'm from the Department of Communications at the World Health Organization headquarters based out here in Geneva, Switzerland. Today, we are back for another social media live Q&A session. I am very happy to be here as your host during the next half an hour. Well, today's topic is very interesting, I have to say, and today itself is very special for us at WHO because it is World AIDS Day 2020, which is happening right now. On this day, the 1st of December of each year, we come together to raise awareness on HIV and AIDS as one of the major global public health issues that is still ongoing. And for this, I am very delighted to have with me today as our special guest, Dr. Meg Verti. Hello, Dr. Meg. Welcome.
Hi, thank you very much for having me today. And I'm very, very pleased to be with you. I am the director here at WHO and headquarters of what we're calling the Department of Global HIV, Hepatitis, and STI programs. And I'm so very pleased to be able to talk on World AIDS Day today. Myself, I'm an HIV infectious disease clinician and public health specialist who've been working in the field of HIV for over nearly 30 years now. So it's very nice to be able on World AIDS Day to remember the important work that's being done to end AIDS as a public health threat.
Oh, that's great. And thank you very much for joining in today, Dr. Doherty. But before we start, let me also welcome our viewers who are joining us from all corners of the world. Perhaps you could take a second and share with us in the comment section where you're watching us from so that we can do a shout out at the end of the live show. And let me remind you one more time, today is World AIDS Day. And during today's live, we will be talking about HIV and AIDS, whether it be prevention, testing, treatment, care services, as well as some challenges, some progress that we have made in the past years. Basically, all things related to HIV and AIDS. And of course, we'll be taking your questions as usual. If you like to ask our experts, Dr. Doherty, who is here with us today, for those watching on Twitter, ask your question using hashtag Ask WHO in your tweet, and for viewers on Facebook, LinkedIn, and Periscope, you can simply leave your question in the comment section below. Please note that the team is moderating questions, including to ensure that those on HIV and AIDS are highlighted first. But before we do that and jump into more detail, let's start things off with some basic questions. If I get it right, Dr. Doherty, it's the 32nd anniversary of World AIDS Day this year. Could you please tell us briefly what World AIDS Day is about and what is the theme of this year?
Well, World AIDS Day was commemorated to really remember all of the people who have lived with and passed away from HIV over these many years that we've been fighting the pandemic of HIV and AIDS. And this year, the theme is global solidarity, and for WHO, we're calling it global solidarity and resilient health services. And why we're so interested in seeing resilient health services or HIV services is during this time of COVID pandemic, we have noted that we need to do and have a special effort to ensure that our services are maintained, that we're engaging, protecting, and supporting our frontline healthcare workers, which are nurses, doctors, community healthcare workers, and that we really recommit to trying to make our global targets to end HIV and AIDS as a public health threat.
Well, thank you very much, Dr. Doherty, for a good introduction of the World AIDS Day this year. But before we dive into this year focus on HIV and AIDS actions and resilient services during the pandemic, I'm sure our viewers who may not be familiar with the terms HIV and AIDS may be having the same questions. And I think it would be lovely to kick off our chat by asking you, Dr. Doherty, what is HIV exactly, and how is HIV different from AIDS?
Thank you. A really good question. And just like many of your listeners who are getting very familiar with infectious diseases, I'll make some comparisons with COVID. So HIV is the virus. It's the virus that causes the disease called AIDS, which is advanced immunodeficiency syndrome. And that disease of a series of opportunistic infections and a series of cancers and other manifestations of the HIV is because the HIV virus is particularly good at or infects what we call as our CD4 cell or our T cell. And that cell is the cell that makes your immune system work. It creates the fighters and in the antibodies in your immune system so that you can fight off other infections. And when HIV is infecting that CD4 cell, it decreases the body's ability to fight off infections that we normally can fight off. So these are called opportunistic infections. So people may develop tuberculosis, they may develop certain cancers, they may develop parasitic infections like cryptococcal meningitis or toxoplasmosis. Some of these diseases you never have heard about, but only when the immune system is not working properly does that come out. And that is AIDS as we know it. So now in our department, we're also calling advanced HIV more very similar to AIDS because there is no reason that people should be dying of AIDS because we have treatments for it. But we do know that some people come to care very late and then they may present with what we call advanced HIV disease. AIDS would be like the SARS-CoV-2 and HIV would be the SARS-CoV-2, the virus, and AIDS would be like COVID-19 in the COVID-19 pandemic.
Well, thank you very much for a very crystal clear answer, Dr. Doherty. But before we continue the chat, I just wanted to remind those who just joined our social media live today. We are talking about HIV and AIDS on the occasion of World AIDS Day. To ask your question on Twitter, use hashtag AskWHO in your tweet. And those of you who are watching on Facebook, LinkedIn, and Periscope, simply leave your question in the comment section below. We will take your questions very shortly. So now we know that AIDS is the most advanced stage of HIV infection, But let's get back to square one. Could you explain to us how HIV is transmitted, or simply how can we get infected with HIV, Dr. Doherty?
So HIV is primarily a sexually transmitted infection. So people who are having unprotected sex, that means any kind of sex without a condom, if one person is infected, they can transmit the virus to another person with whom they're having sex. It can also be transmitted in blood and in semen. And so people who inject drugs or share drug paraphernalia like needles that might have a little bit of blood in it, that is another way that it's transmitted from one person to another. And in the past, there used to be transmissions that occurred through blood transfusions or unsafe blood injections. And these are now in many places in the world, we no longer see transmissions through the blood supply because our blood supply are tested for all various viruses, including HIV and other potential transmittable infections. And we consider now most places in the world that the blood supply is safe. But those are the main ways. So it's mostly these days sex.
Thank you very much, Doctor. So we now have questions started coming in from our live audiences, and thank you very much for everyone for sending those questions. Before we take the first question, we know how HIV transmission and infection look like. So I have just a quick follow-up question on that, Doctor. How do people know if they got infected, or just simply how can people get tested for HIV in general?
Well, the challenge with HIV is it's somewhat is a silent infection in some people. Some people, when they are newly infected after an encounter, either a sexual encounter, an encounter with a needle, for example, they may have fever, they may have chills, they may have a rash. But some people will not even know that they've been infected, and they could go 5-10 years before they show the signs of the infection, and it takes many years to move on to the state of AIDS or the advanced disease. So people should be getting tested if they're sexually active, if they have multiple sexual partners, meaning if people who are young, they often will have various partners before they settle down. And that is an indication that people should go and get an HIV test. Now we have self-testing, and so there's been a really great opportunity to put the hands into the people who want to get tested, and you can do that at home, and you can send it in, or you can do it in the privacy of where you're living or with a partner. But I think anybody who's ever been sexually active in their life should at some point think about having an HIV test. And then thereafter, if they have what we call periods of high risk, where one is concerned that potentially their partner could be infected with HIV, or they've had new partners, then that's a really good time to think about getting a test.
Exactly, I agree. And seeing the first question here, I just wanted to say that a lot of people die from HIV every year because they don't know their status, and because they don't know if they have it, or once they knew, perhaps it's just too late. So I would like to take this opportunity to raise awareness and ask Dr. Doherty about the importance of HIV testing. So the question is, why is early HIV testing important, and how early we should take a test?
So it's an excellent question. I think knowledge is power. And so not knowing if somebody has an infection would not allow them to access the kinds of treatment and care that could save their lives. So in terms of testing, we know currently right now in the world, there may be up to 38 million people living with HIV. Currently right now, 26 million people are on treatment. Another 7 million people don't know that they're infected. And we could put another 12 million people onto treatment. So our advice right now from WHO and our guidelines say, once a person is diagnosed as having a positive HIV infection, they should move immediately to antiretroviral treatment. In the past, we often took a bit of time before people went on to treatment. But now, because the treatments are so easy to take, one pill a day, that as soon as a person gets tested, they can start treatment, and then they can live a healthy, long life. And their length of life could be similar to if they were not infected. So that's the reason why getting tested is so important. So you can take action, get treatment, and then not pass on the infection to other partners that you may have in your lifetime.
Indeed. And we have got a question here from Facebook, just right in time. So one of our followers asked, can people live with HIV, and how long they can live with HIV?
Right now, taking medicines, people can live with HIV a same duration of if you didn't have HIV, if a person faithfully is able to take their treatment for their lifetime. So the treatments, or what we call antiretroviral medicines, or ART, those combination of 3 drugs can suppress the virus. It doesn't replicate in the body. It doesn't destroy the immune system. And if that happens, also, it allows a person not to pass on that virus to other people. So not only is taking treatment good for a person and good for themselves, it's good for public health because it will stop the transmission of virus to others. So a person could live very long if they get on treatment as early as possible. People wait a long time before they start treatment. There could be it could impact their livelihood or their length of life because they may be at risk for other infections. So that's why we really endorse and we encourage everybody to start treatment as soon as possible after a diagnosis.
Indeed. Thank you very much for a great answer. So just a reminder for all of you who just joined us, our program today is on HIV and AIDS and on World AIDS Day. We have here with us Dr. Meg Doherty, Director of Global HIV, Hepatitis, and Sexually Transmitted Infections Programs at WHO. You can send in your questions to our expert using hashtag AskWHO on Twitter, or leave your question in the comment section on your Facebook, LinkedIn, or Periscope. So you have quite a few questions coming in now, Dr. Doherty. Another question is that you mentioned about self-testing kits at home. Our followers on Facebook asked, how does the self-testing kit work? And which type of test is the most accurate?
Well, I'm not going to answer which test is most accurate because almost all the tests now are really at great levels of accuracy. And I would direct you to our WHO website that walks through the different kinds of tests that are out there. But what we call self-testing can be testing that is done with oral fluid or saliva. Mm-hmm. And it's you can buy them in a pharmacy. In some places where they have clinics, you might be able to pick it up in a clinic, take 2 home with you so you can test with you and your partner. And these tests allow you to test on your own, get a response, if it's positive or negative, within 5 to 10 minutes or so. And then from there, make sure and have names and numbers to go get the information and support that you might need for both preventing, and if somebody is negative, they want to prevent getting at risk for positivity again. So there's important follow-up that has to be done for anybody who tests negative, but also testing if a person tests positive. Like I've just said, it's very important to connect with a healthcare worker, with a clinician, with a person who can provide both psychosocial support, but also immediate initiation of treatment and education about the treatment so that they can have a high quality, long life.
Great, thank you very much. So here's another question coming from LinkedIn. Here, our followers is asking, what are the problems faced by scientists for developing HIV vaccines, or is there a cure for HIV at the moment?
Right. Well, thank you for this question. These are such important questions because I think sometimes we look at HIV and we've been living with the virus, know about the virus for nearly 40 years or so, but we don't have a vaccine. Mm-hmm. And why not? Because in 1 year with the coronavirus, we've been able to have 2 to 3 to 4 vaccines ready to be started within the year. These are different kinds of viruses. That's the major challenge. And the challenge with HIV is it attacks your immune system. So the very system that you want to get started to be able to fight the infection is destroyed by the virus. So that in itself is a complexity about how to make a vaccine that doesn't allow the virus to get into an immune cell, but also allows the immune system to rev up. And I think this is the scientific challenge that so many researchers have been working on for many, many years. I think what's a good thing about that is some of the vaccine platforms that have been developed for HIV have gone on and been recycled and used for helping to develop vaccines for COVID. So it's good science, and we've learned so much about our immune system through HIV. What we're looking at more so with HIV is there is vaccine work going on. There's been a trial that has shown with 2 different kinds of vaccines, we can achieve what we call some efficacy of about 30-40%. Not enough to actually stop the virus from replicating in communities, but certainly there's never been a really successful vaccine trial like we've seen with COVID. The one thing I did want to say, though, is the new science is really focusing on cure. And where we see that, number one, with treatment, the virus can be suppressed and you don't pass it along to others. But there have been 2 cases now where people who had cancers had what we call a bone marrow transplant, and their immune system was essentially refreshed. And that immune system was refreshed with cells that were not able to be infected by the HIV virus. So their immune system remained intact. And these two patients, you might have heard of them, Berlin patient and the London patient, have lived now lives where they don't have evidence of infection. So a lot of the science is now working on how can we recreate the same system or the same approach of a bone marrow transplant, which is a really serious medical intervention that's very dangerous. How can that be recreated in medicines that we give to people so that we can eventually potentially have a long-term cure for HIV?
Okay, thank you. I'm glad that we have seen some progress in the past years, and scientists around the world are working on delivering the vaccines. And as we know that, COVID-19 pandemic has set back some public health progress in the past months. Dr. Doherty, could you please tell us what is the global situation today of HIV and AIDS, and what is the impact of COVID-19 it has on the progress that the world has already made in the past years?
I think that's such an important question, because it's one of those reasons why we've selected global solidarity and resilient HIV systems as our theme for this year, because it's been a really dramatic year for all other health systems. For HIV, we now know that we have 26 million people on antiretroviral therapy, but we're far off our targets. And we will not make any targets for this year, 2020, where we were supposed to have almost all countries around the world reach 90% of people knowing their status, 90% of those on treatment, and 90% of those with what we call a viral suppression. And so we're off our global targets, and we still have far too many new infections every year. In the end of 2019, we had 1.7 million new infections, and we had nearly 700,000 deaths. And to be able to eliminate eliminate AIDS as a public health threat, we have to get to rates much lower than that, under 500,000. And so we know COVID has had an impact on the work that we do. What we have been following WHO and our partners, we've been following data every month. And we've seen that the rate of testing has gone down.
Right.
We have seen the number of new people put on therapy not as high as we would expect. But the silver lining is that we've seen people who are on their treatment, that programs have really worked so hard to maintain them on their treatment. And so therefore, we're seeing some good outcomes. And lastly, we've been, during the periods of lockdowns or logistical challenges in the months of May to June, we were very concerned that people would not have access to their antiretroviral medicines or their treatment. And that's the kind of treatment you need to take every day. And so we've worked very hard to ensure that all the stockouts or potential stockouts of ARVs have been solidified. And we've seen those rates of any kind of disturbances in antiretrovirals go down by 75%. So we only have a very few countries with challenges. So Thank you.
Well, indeed, but despite these additional challenges, I have read an article on our website, on the WHO website, that there are countries around the world that managed to come up with some amazing innovations in HIV service delivery during the COVID pandemic. It would be lovely if you could highlight some of them, perhaps what they did and what the difference they make in the HIV and AIDS community during this crisis.
Yes, I think that is been perhaps the most inspiring things from people who are working in the HIV field, for people who are living with HIV, that they know how important it is to ensure that people have access to services, that there is that the community fights against stigma and discrimination and really protects and empowers people to have access to the treatment and the care and the prevention that they need. So what we've seen that's been really inspiring is that early on, programs realized they wanted to move treatment further into the community and to empower people to take care of their own health. And an approach that we call differentiated service delivery included giving longer prescriptions to people for their HIV medicines, for their medicines for opiate substitution therapy, for their medicines for TB treatment. And by giving people longer prescriptions of 3 to 6 months, it protected them from coming into clinics where they might be at risk of COVID infection, but it also allowed the healthcare systems to handle all the people who needed COVID attention. Now, these good practices we'd like to see continued, and that would include also having e-health, e-consultations, providing PrEP or pre-exposure prophylaxis medicines in the same way as we provide antiretroviral therapy. So we're looking forward to seeing some of these great innovations continue after perhaps we're in what we call our new normal, when we get to have some vaccines and people going back and doing their usual travel and their other kinds of movement in and out of health facilities.
Right, even though we are experiencing some particular time, but there are some great news that are happening around the world, especially for HIV and AIDS in AIDS community. So let's take a couple more questions from the audience. We have got a question here from Facebook. Okay, so one of our followers is asking, do HIV patients are more vulnerable for COVID-19?
So I think this is one of the most important questions that we've been looking at and struggling with. And there are conflicting pieces of information in the literature and in what we call the evidence that gets published in medical journals. Early on, there were some very small studies in hospital patients that looked like people living with HIV and people who didn't have HIV had very similar outcomes. In around June, July, there were a couple of studies that looked at larger numbers of people, and this would be in South Africa and also in the UK, where it looked like there might be a moderate increased risk for people who have HIV for having poor outcomes with COVID infection. But it's hard to know because these studies needed to be able to control for all the known risk factors with COVID, people who have cardiovascular disease, diabetes, are overweight, having pulmonary problems. But I think overall the sense is that there may be an increased risk, but the best thing that we need to do for people who are living with HIV is ensure that they have a viral suppression, that they are getting all the extra treatments that they need, that if they have diabetes or heart disease, that those are well controlled, so that we can control any other risk factors that could augment any risk for COVID. And lastly, WHO is committed to look at this, and we've set up a database where we can start to have all countries around the world provide us with some of this information. And currently, right now, we have 30 countries who are providing us that information. So I would say in the next few months or so, or certainly by the mid next year, we should be able to say something with a little bit more surety about whether or not there's a risk. But in any case, we all need to do the right things. Wash our hands, right, distancing, wearing a mask where indicated, and if living with HIV, take all precautions of keeping the virus well suppressed.
That's right. And there's another question from Facebook from Rupalina Onyam. She's asking, can you tell me more about the PrEP for women?
Yes, and I think this is a very exciting, and I'm glad somebody brought up this new news. We have so many options for what we call pre-exposure prophylaxis, or PrEP. And this is a medicine which is the treatment for HIV, but in a single pill or a pill with two medicines together that can be used among people who don't have the infection, but could be potentially at risk from infection from a sex partner, from an injection use partner, etc. So this pill or PrEP we now have new options that are coming along that are super exciting. The one that WHO just pre-qualified, meaning we went through a regulatory process to say it's okay to use, is something called a dapivirine vaginal ring. And that's a ring that is embedded with the medicine, but that a woman can wear inside her vagina around her cervix for a period of time, and it gives off the drug so that she can protect herself from HIV from any of the partners that she may have. There are other methodologies that are coming out right now, which are an injection, where the drug is given in an injection that can last between 4 weeks, 8 weeks, and even longer as we go forward. And those studies have come out this year. They're really exciting, and it gives women and men options for prevention that may be better suited to their lifestyle, where they don't have to take a pill every day, but they can take an injection, and that will protect them for the next 4 weeks to 8 weeks.
Well, that's some great news out there, and I am so glad to hear that. So I have one interesting question before we're moving on. One viewer from Facebook, she's asking, can a mother with HIV give birth to a healthy child?
Yes, and that's such a good question, because I know mothers and families and parents they're very worried about and want to ensure that they have a healthy child. And early on in the HIV epidemic and pandemic, there were so many children who were born with HIV because the mother didn't know that she was infected. So this is a very good reason for all pregnant women to at some point have an HIV test. Because number two, you can give medicines during pregnancy and for the lifetime of the mother that will interrupt the transmission of that virus to the child. And number three, even if a mother comes in late and delivers a child, the mother and the child can take medicine right after delivery, and that can also interrupt transmission of the virus to the child. So important during pregnancy to have an HIV test, and if positive, to take medicines, and then the baby also will take medicines and will have to have a series of tests, and eventually at 12 months they'll be able to say whether or not the child has been infected. Now we are seeing that this mother-to-child transmission, that we can eliminate it, and we're certifying countries who have eliminated that transmission. So there's no reason for a child now to be born with HIV if we all do what we need to do in terms of addressing our public health responsibilities around HIV.
Oh, that's great. Oh, okay. And you mentioned earlier at the beginning of the live that this year we are calling on global solidarity and resilient services for HIV and AIDS. Some of our viewers are asking, is there anything individuals can do to help fight and end AIDS?
Absolutely. I think this is such an important question, because globally we can't do anything unless individuals are committed. Right. So individuals make up the global community. So every single action that a person takes and decisions that they make is about that solidarity. So when our Director General, Dr. Tedros, asks people to do the right things, wash their hands, physical distancing, wear a mask when indicated, don't travel, be careful, to avoid COVID. It's the same about other infectious diseases like HIV. So the solidarity that I think mostly now we really have to engage with young people like yourselves who are using Facebook for engagement, for your communication, for also learning, that we have to share the information so people are aware. I think now HIV and AIDS was so well known in the 80s and the 90s because we saw so many people, so many public figures dying of HIV, that it was very, very meaningful to people. They felt it. They knew people who had died. They knew people who were affected. Now, as we grow, as more infections occur, and as we get closer to being able to treat everybody well, I think there's a sense of not a complacency, but potentially not as many people are aware of the risks of HIV. And so we have to educate ourselves about the risks. And if you are somebody who is interested in the HIV and ending the AIDS as a public health threat, get involved and be part of your community. Work with those who are in the community, ensuring that everybody has equitable access to testing, equitable access to treatment. And I think only then can we actually make our goals globally. So I think it's back to your audience, who really needs to figure out what it is that they want to do personally, right, keeping themselves healthy, but working within the community in which they live.
Right. So I agree that, social media is a powerful tool that we can all use to voice out and raise awareness on the risk of HIV infection. And that's, we have a follow-up questions after you mentioning the youth and what we can do. So Joshua from Facebook, he's from Nigeria. He's asking, what can the youth do to reduce or prevent the spread of HIV infection?
Well, I think youth, that's an excellent question. And I think we need to generate a new community of advocates, of people who are educators. We need a new community of people who are really going to take on the HIV fight and lead it and be leaders. And so youth in Nigeria, they're, around all around the world, there is HIV, but in certain parts of Africa, there's even higher levels. And in Nigeria, there's quite a bit of work to be done. So I would suggest tuning in to the HIV page in your country's Ministry of Health, ensuring that in education, in university and in high school, that young people know about the risks and that they know about how to prevent HIV. We know in Nigeria, there's a wonderful prevention program going on right now with PrEP. Get involved, learn about it. And I think the other thing is to promote testing and to make talking about sex and understanding your partners really commonplace and something that can be done regularly. And hopefully you can find a clinician, if you can't talk to a family member, somebody that you can talk about and get the right advice for your sex life and to keep yourself free of infection.
That's a great advice for the youth community. And I have this question. What about WHO? How does WHO contribute to this global effort in ending AIDS?
Well, thank you very much. WHO plays an important role as being the #1 normative agency. So one of our main responsibilities is to ensure that every country around the world has the right information, has the right guidelines, the right policies. We look and we scan regularly all the research that is coming out around HIV, and we put out new recommendations on, if we see, for example, the dapivirine ring, the long-acting injectable prevention. We are already ready to start thinking about putting out recommendations on how best to use this. We work with other partners, the Global Fund, PEPFAR. These are partners that have a lot of funding to donate to countries for big programs. And we make sure that those programs are using our evidence base to do the right thing in the country. Use the right drugs for treatment, use the right testing kits. And then lastly, WHO works with all of our regions and countries to ensure that all that new information is used by ministries of health, is implemented, and clinicians and people who are at the frontline healthcare workers are armed with the right information.
Okay, let's take the last question here from LinkedIn, following that you said about using the right drugs. Do HIV drugs have side effects?
Thank you. Yes, we know that all drugs, any drugs that you take, in the end has some side effects. But the HIV drugs in the very beginning were very difficult to take. A person might have to take a handful of drugs 3 or 4 or 5 times a day to be able to keep the virus suppressed. And they would cause nausea, diarrhea, headaches, sometimes GI challenges, sometimes, moving on to cardiovascular disease, high lipids. The drugs that the majority of the people can take today are very well tolerated. WHO recommends as a first-line regimen something that combines a drug called tenofovir, lamivudine, and dolutegravir. And those 3 drugs together in a single pill, most people can take without any challenges, no major side effects. So it's really come a long way in the last 30 plus years.
Right. That's great. Okay, I'm seeing that we are running out of time here, but before we close our conversation, Dr. Doherty, do you have any last word or a message to share with our followers or our viewers today on World AIDS Day?
My one message is that we really need to call and commit all of you to ensure that we're working towards regaining and rebuilding our systems after COVID so that we can reach our goal of ending AIDS as a public health threat by 2030, and that we need to engage, support, and protect our frontline healthcare workers who are doing that for us. And what we need to do is to protect them from COVID, ensure that they have the PPE, and we're doing our part, wearing masks, washing our hands, and doing physical distancing so that we don't pass that on, so those healthcare workers can keep moving forward with providing high quality HIV care.
Well, thank you very much, Dr. Doherty. That was quite a good point to end on, that everyone has a part to do in this mission to end AIDS by 2030. And I think while the challenge of ending AIDS is still significant, I believe that we are getting there, and ending AIDS is possible if we work together. So I think we're running out of time. Thank you very much, Dr. Doherty, for taking the time to talk to us today.
Thank you very much. I really
It was very useful and interesting. And today we had a great audience watching us from all over the world. So I'm just gonna list out some countries from viewers from Algeria, Afghanistan, India, Bangladesh, Germany, Cameroon, USA, Nigeria, Kenya, Zambia, France, Pakistan, Sri Lanka, Cambodia, Colombia, Spain, Iran, Thailand, Philippines, Tunisia, Ghana, South Africa, Myanmar, and so on around the world. And thank you for tuning in, everyone, for sending in interesting questions. I hope you've learned some useful information from our expert, from Dr. Doherty today, as I have. Thank you again, Dr. Doherty, and thank you, everyone. Stay safe, and until the next World AIDS Day. Bye-bye.
Thank you.